Good afternoon, everyone. Bon après-midi à tout le monde. Bienvenue à cette mise à jour sur le COVID-19 au
Welcome to today's update on COVID-19 in New Brunswick.
COVID-19 in New Brunswick. Les porte-paroles cet après-midi sont
The spokesperson today are the province's Chief Medical Officer of Health, Dr. Jennifer Russell, and Premier Blaine Higgs.
Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Blaine Higgs, Premier of New Brunswick. Dr. Russell.
Thank you, Bruce. Merci, Bruce. Bon après-midi à toutes et à tous.
Good afternoon.
L'une des très tristes réalités de la
One of the very sad realities of this COVID-19 pandemic is that people die from the effects of this virus. Over the past week, we have recorded several deaths. 2 deaths were reported yesterday, and there has been one more reported today. A person aged 19 and over residing in Zone 1, which is the Moncton region, has passed away. These are not just numbers. These are people with lives and families who loved and were loved.
One of the very sad realities of this COVID-19 pandemic is that people die from the effects of the virus. Over the past week, we have recorded several deaths. 2 deaths were reported yesterday, and there has been one more reported today. A person aged 90 and over residing in Zone 1, which is the Moncton region, has passed away. These are not just numbers. They are people with lives and families who loved and were loved. They were our fellow New Brunswickers. Each of the 57 deaths we have seen has diminished our province. My heart goes out to the families of these New Brunswickers in their time of sorrow. Your loss is felt by everyone in the province. Through this pandemic, we have all learned the hard lesson that we must accept the reality that we are experiencing, and that things will rarely go as we expect and hardly ever as we would like. We are in a dance, and it is the COVID-19 virus that calls that tune. And that dance that I'm referring to is that pattern of the hammer and the dance, whereby there are strict public health measures in place, and then we try to ride the different waves when that happens. When the virus has been very active, public health has recommended measures to government and the public to slow its spread. And when the virus has been less active, we have advised that these restrictions be relaxed. And these decisions that we have made at every turn in this pandemic are based on science and evidence: the epidemiological course of the virus, the social determinants of health, the state of our healthcare system, and New Brunswickers' mental health. Again, taking into account that this is at a population health level. Lorsque le virus était très actif,
when the virus has been more active, public health has recommended measures to government and the public to slow its spread. When the virus has been less active, we have advised that these restrictions be relaxed. The decisions we have made at every turn in this pandemic are based on science and evidence. The course of the virus, the social determinants of health, the state of our healthcare system, and New Brunswickers' mental health. And it's clear that the stricter measures have a very negative impact on our economy, our society, and our mental health. We must strike an appropriate balance in the measures we take.
An appropriate balance in the measures we use. We cannot lock everyone down everywhere until the last case of COVID-19 has been eradicated. We have seen the toll that these measures take on our mental health, on our society, on our economy, on our education system. We are now in a serious situation that calls for serious measures. That is why we have moved away from the green phase of relaxed restrictions and brought back the state of emergency and the more stringent measures that are necessary to limit the impact of the COVID-19 virus. These new restrictions are not forever, any more than those we have recommended in the past. When the pressure on our hospitals has been reduced, we will be able to once again be able to relax the most restrictive measures. This will be the way of things for the foreseeable future. En date d'aujourd'hui, 70
As of today, 79.8% of New Brunswickers are fully vaccinated. This is a significant achievement, but we can't stop there. We need everyone who can do so to roll up their sleeve, to protect themselves, their families, and their communities.
Brunswickers are fully vaccinated. This is a significant achievement, but we can't stop there. We need everyone who can do so to roll up their sleeve to protect themselves, their families, and their communities. Our hospitals are coping with the influx of COVID-19 patients, but our healthcare system is under strain. As of today, there are 40 New Brunswickers in hospital due to COVID-19, with 16 of those patients currently in ICU. We need to reduce these numbers significantly before restrictions can be relaxed. We continue to see elevated case counts across the province, primarily among New Brunswickers who have not been fully vaccinated. The full list of the 84 new cases of COVID-19 reported today will be in our press release and on the GNB website. The increase in cases has led to an increase in demand for testing. And there have been delays in processing tests due to this increase, and our regional health authorities are responding. They are expanding capacity at assessment centres in Fredericton, Moncton, and St. John, and hired additional staff to expedite processing. Testing is processed on a priority basis, with emphasis given to slowing down the spread of the active outbreaks within the province. There will be delays in processing tests for travel or other non-urgent reasons, and I ask everyone to be patient as we work to limit the spread of this virus. And again, I know that people are fatigued, there's no question, but I do ask that we continue to be kind. The measures that we have taken, and we will continue to take, are focused on protecting our healthcare system. And the evidence shows that for most of us, 2 doses of COVID-19 vaccine provides good protection against the harmful effects of the virus and the need to be hospitalized. It is clear that some people will need a booster shot. La semaine dernière, nous avons
Last week, we authorized a 3rd dose of vaccines for New Brunswickers whose immune systems are severely compromised, including cancer patients and those with immune-suppressing diseases. Based on new advice from the National Advisory Committee on Immunization, we will now offer a booster to seniors living in long-term care homes and other congregate settings who have already received their first 2 doses of an mRNA vaccine. This will begin in early October.
Last week, we authorized a 3rd course of vaccines for New Brunswickers whose immune systems are severely compromised, including cancer patients and those with immune-suppressing diseases. This will help strengthen their body's defenses against the virus. Based on new advice from the National Advisory Committee on Immunization, we will now offer a booster to seniors living in long-term care homes and other congregate settings who have already received their first 2 doses of an mRNA vaccine. This will begin in early October. Our plan is to administer the COVID-19 booster along with our annual flu vaccine campaign. New advice from the National Advisory Committee makes it possible for us to provide both vaccines at the same time. And I'm sure that every New Brunswicker wishes that the COVID-19 pandemic was over. I am definitely in that camp with you, but this is the reality that we are facing. So we can't wish away the pandemic, but we can work together to protect ourselves and our fellow New Brunswickers by following public health guidance and advice. We can protect our mental health by taking a break from our phones and tablets and get out and get some fresh air. I know my daughter was really excited to go apple picking, so we're hoping to try to fit that in. We can take positive actions that will limit the spread of the virus, washing our hands regularly, wearing a mask in public places, maintaining physical distance from others. Most of all, we need as many New Brunswickers as possible to become vaccinated against COVID-19. We can stand together and bring these outbreaks under control. And I know that we can do this because we have done it so many times before. So please stay strong and protect one another and support and encourage one another. Thank you very much.
Good afternoon. Bonjour. Marcia and I were once again saddened to learn today that another New Brunswicker has lost their life as a result of COVID-19. We would like to express our sincere condolences to the family and friends of everyone who has lost loved ones over the past few days as a result of this virus. Our thoughts and prayers are with all of those who have been impacted by these tragic losses. 1 week ago, new public health measures came into effect in New Brunswick, including the mandatory use of masks in indoor public spaces, a requirement to show proof of vaccination when accessing certain businesses, and a travel registration for everyone entering the province. The state of emergency was reinstated last Friday, and the mandatory order went into effect at midnight. Les mesures supplémentaires.
These additional measures will limit contacts, guarantee physical distancing, and require that some businesses and some events establish a vaccination policy or workplace screening.
Inspectors and peace officers with the Department of Justice and Public Safety and WorkSafe New Brunswick visited 2,691 locations across the province. The goal of these initial visits was to ensure businesses were complying with the new regulations and to educate business owners, managers, and staff. I am happy to report that in this first week, 94% of businesses were in full compliance. This is indeed very encouraging. I know it hasn't been easy for businesses, and it's not easy when new rules are introduced, but time and time again, throughout the pandemic, the vast majority have stepped up and done what is needed. I want to thank the business community for adapting so quickly to the new rules. This week, we will be focusing on the small minority of businesses that are not in compliance. If you own or manage a business that is not making an effort required to keep us all safe, there will be consequences. Those who fail to comply, even after being advised by officers or inspectors, will face fines starting at $480, plus surcharges. Of course, much higher fines may be issued for repeat and ongoing violations, up to $20,400 per offense per day. I hope that fines will not be necessary. Je veux croire que
I believe that everyone is trying to do what they can to protect their neighbors and fellow New Brunswickers.
Part of why we are in this position is because of the eligible New Brunswickers who have still not gotten vaccinated. With increased COVID-19 hospitalizations, we are seeing high occupancy rates, approximately 94%, in hospitals across this province. In the Upper River Valley Hospital, as an example, the labor and birth unit is closed temporarily as staff have been relocated to deal with COVID-19 cases. There are a few ICU patients from Evanston being transferred to Fredericton. The necessary changes are being done throughout the network. However, the network is strained, as Dr. Russell said. Les personnes qui ont besoin de services.
People who need health care in the province are all affected by this situation. This situation has serious consequences on our healthcare professionals. They need to work longer hours, and they need to deal with bigger workloads.
Responders have been working since the beginning of the pandemic to help keep us safe. I want to take a moment to thank them and let them know how much we appreciate their efforts. I especially want to mention our nurses. The best thing we can do to help nurses is to increase the number of nurses working in New Brunswick hospitals. And that is our commitment. In recent years, most recent graduates were offered casual work upon graduation and later could apply for full-time positions. We are working with our partners at the regional health authorities to ensure that going forward, every graduate from a New Brunswick university is offered permanent full-time employment as soon as they graduate to help alleviate some of the stress on the system. We also need to work on increasing the number of newcomers who arrive in New Brunswick every day with international nursing credentials. And when they do arrive here, we must expedite their accreditation to ensure their skills are properly recognized. We know there's plenty of work to do, but we are committed to getting it done. Le nombre de cas.
The number of cases remain high, and the number of hospitalizations is worrisome. We need to keep in mind that the new measures were only enacted last week. We will need to wait before we see results.
Result of actions that likely took place before these measures were in place. As Dr. Russell said, we are aware that many people have been experiencing long wait times to get tested and to get the results. Currently, more than 4,600 people are in isolation in New Brunswick, many of whom are waiting for a test. I sympathize with those people, and I want them to know that we are currently looking for ways to alleviate these wait times and fix this problem, and it is getting better. For now, we need to be patient. If we continue to follow the rules and listen to the advice of public health, case numbers will decline soon, and we will all be able to move beyond this fourth wave together. Thank you. Merci.
Thank you.
Thank you, Premier. Merci beaucoup, Dr. Russell. Nous allons maintenant procéder aux questions, aux périodes de questions avec les membres des médias. Vous avez le droit de poser vos questions dans la langue officielle de votre choix. Chaque journaliste aura une question. We'll now proceed to question period with members of the media. Each reporter will have one question. You have the right to pose your question in the official language of your choice. Vicky Hogarth, TV.
Thank you, Bruce. Premier Higgs, Horizon Health said some members of the public have approached public health staff to falsify vaccination cards. Can you tell us any more details and also what type of repercussions a person would face if they were to falsify a proof of vaccine and use it to go into establishments?
Well, I would be very surprised if anyone would actually agree to doing that. And obviously, it would be grounds for discipline of some sort. I would say termination of employment would be within that realm, but I would be very confident that it's not only unfortunate that someone would ask, but it's I'm confident that they would be refused.
And I can just add to that. So under the Public Health Act, it actually is an offense to make a false statement, either orally or in writing. And so with respect to proof of vaccination against COVID-19 medical exemption or travel, so under the mandatory order, a peace officer would be able to issue a fine in the amount of $480 plus surcharge and fees. And in instances where an offense is brought to court in certain circumstances, a judge may issue a fine to an amount not exceeding $20,400.
Thank you both. Thank you, Ms. Hogarth. Erica Butler, CHMA.
Hi there, thank you. There's epidemiologists out there saying that rapid tests can be a tool to help snuff out outbreaks quickly and to keep places like schools open when there are cases in the community. And I've been told by the Department of Health that one high school in Perth Andover has been using rapid tests in, I guess, a kind of pilot since last week. New Brunswick has received over 1 million of these tests, but we've only used 2.1% of those. So they appear to be cheap and plentiful, and I'm wondering what is the holdup in using these tests as an extra measure in schools, daycares, and nursing homes?
Yes, so we are looking into how we can expand that program and making sure that it's used effectively and appropriately with all of the other tools from public health in terms of measures and contact tracing and isolation at this point in time. In terms of, why is it taking so long? Again, we're doing our best right now, and as more information becomes available on rolling that out, we can provide that. But we certainly acknowledge the issue right now about testing backlog. And actually, my apologies, that actually there is no testing pilot program as of right now. The tests are issued throughout the province, and there are small businesses and large employer programs, but it is our intention to partner with education and early childhood development to look at that. But again, I don't have a timeline on when that would happen.
Doctor, thank you, Ms. Butler. Tim Roselle, Global TV.
Hi, good afternoon. My question, I guess, would be for Premier Higgs. Premier Higgs, you and I spoke yesterday after the meeting of the Atlantic Premiers, and you had mentioned that there were no intentions at that time to add any new restrictions or make any changes, at least until the recent changes that were made have a chance to kind of take effect, and until the effect of those changes becomes clear. What has changed now, and what are the changes going to be? What's happening right now?
Well, right now, we're not introducing new changes. We're only talking about what enforcement of the rules that are currently in place. As Dr. Arnold just mentioned, we are looking at a testing policy for schools and in the education system and using rapid testing, and that'll be brought forward by the Department of Education in the coming days or week. And the issues around the backlog of testing to understand certainly what can be done there, and prioritizing to see that people that are impacted directly and that has, let's say, other impacts, unintended impacts, would be dealt with on a priority basis. I think that what we are doing right now, understanding hospitalizations and how we, as I mentioned, about transfers that are made or some things that are changing in a hospital to mitigate the impact on critical hospital requirements for other patients other than COVID. So those are things that are happening to manage the system that we're in right today. But new measures at this stage are not being contemplated as part of today, but it doesn't mean that it won't come in the future.
Thank you. Shelley Steeves, Global TV. Okay, we'll move on to Timothy Jakes with the Tribune.
Yes, my question's for the Premier. One of the exemptions to the border registration rules applies to, and I'm quoting, those accessing medical care not available in New Brunswick, end of quote. But this doesn't seem to apply to those from Quebec accessing healthcare services or pharmacies in Restigouche or Madawaska counties who have traditionally sought these services in New Brunswick, and that includes hospital services. Can you clarify the status of these people from Quebec if they're not fully vaccinated in order to cross the border?
At this point, I'm not aware that Quebec would be treated any differently than other Atlantic provinces in relation to accessing medical services. There will be precautions taken if these services are critical, certainly if they're not vaccinated, but we have not restricted access for medical reasons for anyone in that sense. It's just additional precautions have to be taken. And I would say, as far as being access to pharmacies, that could be an issue to discuss. How would those health needs or prescriptions being filled, how would that happen? But to ensure that someone can get their prescription, I would think we could figure that out.
Thank you, Mr. Jakes. Adam Huris, Brunswick News.
Thanks, Bruce. Just to follow up on Premier Higgs's comment that enforcement officers visited 2,700 businesses. Were there any tickets issued to those businesses? And then you said this week you're going to focus on those that are not complying. how would you know who's not complying? Is this through tips, or I guess how would you determine that?
The public safety officers actually went through communities throughout the province and visited businesses randomly. And, in some cases, they may have had information, but primarily it was kind of a general inspection throughout the province of let's say, just under 3,000 businesses. And no, there weren't any fines levied at this point. Then we reported over 90% compliance. But for those that weren't compliant, I would say that at this point it was given clear instructions as this is what it will take for you to be compliant, and you need to do so within a certain time frame. And those businesses will be followed up on this week. And if further non-compliance exists, then that's the point when tickets start to show up.
Thank you. Michel Corriveau, Radio-Canada.
Merci, Bruce.
Thank you, Bruce. My question is for the Premier, Mr. Higgs, and maybe Dr. Russell will want to answer as well. So here's my question. It's the Human Rights Commission of New Brunswick. They said that they received many complaints of individuals, so they think that the vaccine measures are violating their rights. What do you think about that?
Clear instruction and interpretation, which I think we can share directly, and that outlines clearly about the position that this is not a human rights issue. There's not a violation issue here. It's a public health, public safety issue, and I think we should forward that directive or that interpretation to you, Michelle, so you can read it directly.
Merci beaucoup. Bobby Jean McKinnon, CBC.
Yes, thank you. Can you hear me?
Yes.
Dr. Russell, can you please tell us what our current testing supply stocks are and what you expect those to be in the weeks and months ahead?
Well, I think for right now, we're focused on getting our turnaround times to be lower and making sure that we have that individuals have access to testing and in a timely way. So, a few of the things in terms of reducing that backlog is to prioritize, as we always have, is the capacity to test making sure that we have the capacity to test the close contacts of known cases. So asymptomatic double vaccinated individuals also account for a large number of the increased demand. So if you don't have symptoms, please self-monitor and only request a test if you are symptomatic. Individuals not identified as contacts of cases are accounting for the vast majority of the backlog. We don't currently have any issues or reports around supply issues, so that's not part of our, part of any of the outstanding things that are happening right now. So again, we are continuing to triage and do the contact tracing and getting people registered for the testing. And I know that the Georges Dumont Hospital and the Moncton Hospital, I think they're working really hard to make sure that that testing capacity is there and that it gets done. And I think we're hitting really record numbers of testing and processing. And again, at this time, trying to reduce that turnaround time from the time that somebody requests a test to they actually get the test, they actually get a result.
Thank you. Thank you, Ms. McKinnon. Jean-François Boisvert, l'Acadie Nouvelle.
Yes, I have a question for the Premier. Mr. Higgs, you said recently that it would be possible to see a vaccine passport between the Atlantic provinces while we wait for a national vaccine passport. So, Quebec is our direct neighbor, and they have already established a QR code system. So in New Brunswick, did we think about joining the system to harmonize the situation so that we can have a system for the whole eastern of Canada, not only for the Atlantic provinces?
You are exactly right. But to clarify the position, we are each working on different timelines in the Atlantic region on having a vaccine registration. And we said that we were working towards, an automated system, a QR code, but also it wasn't so much as harmonizing between the four Atlantic provinces, because your point of Quebec already has one. Would we look at theirs and harmonizing in a more widespread fashion? But Yes, but even further than that, the federal government has indicated during the election and since, and I have meetings with federal government officials in the coming days, basically to look at the full national code that would allow us to harmonize across the entire country. So it would be recognizable at every province. So that is the ultimate goal. And for now, what I would hope, because my initial understanding was it was going to take many months for the federal system to be in place, and we will learn that in the coming weeks how long it's going to take. But my goal would be to harmonize with the national plan, and I know that's my colleague's goal as well in the other provinces, and the Atlantic provinces particularly. But ultimately, you're absolutely correct. That is our goal. We need to harmonize our system across the country.
Merci, Monsieur Boisvert. Thank you. Savannah, Telegraph Journal.
Hi there, can you hear me?
Yes, Savannah.
Great. My question is for Dr. Russell. On Friday, we had Mr. Chalifou talk about the projections for hospitalizations kind of over the weeks leading up to when we would see these new public health measures take effect in terms of the case numbers. He said that public health was projecting between 35 and 40 hospitalizations at any one time over the next 2 weeks. I'm wondering what the projection is for the case count, whether that be, I guess, the active cases at any one time, as well as how many deaths we can expect to see over that time.
So basically, the information that is presented at Cabinet includes some of the scenarios that you just mentioned. And at the technical briefing on Friday, we did share that in 2 weeks' time, we did expect the hospitalization rate to go to 35 to 40 beds to be occupied with COVID-19 patients as per the medium risk scenario that we were projecting. So other than that, we will continue to have discussions about where we're going and where the trends are happening. It does take several weeks to see the impacts of public health measures that are put into place, give or take. So it's not clear at this time, again, how quickly things will start to trend downward, but we're hopeful and optimistic that that will be the case. But as of right now, we don't have any other projections that we're working with, just the ones that we just presented on Friday. And again, we're just keeping track of the case numbers as they come in, and the hospitalization rates. Again, we're working with the RHAs around the capacity and what's happening to juggle the services that need to be adjusted based on that right now.
But if you have a medium risk projection for hospitalizations, I'm sorry, you don't have a medium risk projection for cases?
That was it. The one we presented on Friday was the medium risk projection. We did not have a projection for deaths, but, prior to the variants of concern being at play, in particular the Delta, and prior to vaccination rates, we used to see a breakdown of cases, unvaccinated people, prior to variants of concern being involved. Around 80% of people would not have very severe symptoms, 20% of people would have symptoms, 15% of those would require hospitalization, 5% of those would require ICU admission, and about half of those ICU admissions could result in death. Now, again, those are projections and stats that we used prior to variants of concern being involved and prior to our population being vaccinated at the level that it is right now.
Thank you. Alexander McDougall, Holton Pioneer Times.
Oh, yes. Not sure who my question should be directed to, but I'm just curious. I know that with regards to international travel, it's up to federal jurisdictions, but I remember sort of not last summer, but the summer previously, there had been some additional restrictions for international travel to New Brunswick. So I'm curious, with the reintroduction of the state of emergency, could there be any sort of potential disruption to international travel just at the provincial level? Or is that something that would have to go through, federal matters?
International travel would be federal responsibility, and so we would be looking for the federal government to put rules and regulations around that. I And I do believe that's happening. I mean, we've seen recently the changes that were made to the U.S. requirements as an example, the vaccines that were accepted or not, and where the AstraZeneca has now been accepted as to go to the U.S. is kind of a new development over the last little while. So that would be federal. We would be looking, and we are, have our rules as far as travel that's domestic, and that would be our jurisdiction at this point. But we work closely with the federal government, and they update us on policy changes. So we would just stay together on making sure that we can keep our population safe.
Thank you, Premier. Thank you, Mr. McDougall. Dr. Russell has some follow-up information pertaining to Erica Butler's question and also Timothy Jake's question.
So for Erica Butler's question around rapid tests, I'm not sure where your information came from, but we have not only used 2.1% of our rapid tests. We have shipped out thousands of the rapid tests through our Chamber of Commerce, and I think it's upwards of 125,000. So just to clarify that. And then the next piece is around Tim Jake's question. So between Hamilton and Quebec, there is a Jean Coutu with a pharmacy on the Quebec side of the Hamilton border, and unvaccinated Quebec residents can access the pharmacy there.
Thank you. Angèle Moore, APTN. Robin Grant, Brunswick News.
Hi, this is a question for Premier Higgs. First Nations leaders call your government's decision not to recognize the first National Day for Truth and Reconciliation as a provincial holiday a missed opportunity to repair damaged relations. What's your response to that?
Well, I think that, we've seen various positions taken across the country with provinces and with municipalities. However, there is a symbolism attached to that request or that situation the federal government took during an election. However, I would like to have more concrete actions that people can actually see a relationship repaired in tangible ways. And that's why, looking at the Truth and Reconciliation report, we've initiated 27 of the 31 recommendations that are now underway and to be implemented. In some ways, some examples of that would be bringing our First Nations history into the school curriculum. We've agreed to create a monument to mark this dark past in our Canadian history and how we can manage, to inform and educate. We've established a systemic racism commissioner so that it's real, tangible work in relation to repair a relationship that we must in order to move forward together as a society. So I'm disappointed if it's seen as a slight in any way, because having more people take a day off is not necessarily going to encourage or learn more about the challenges we're facing together in our country and how we can manage them together. So, but having tangible results in areas that are important, and to look at communities across our province and say, every child in every community in New Brunswick needs to have the same hope of what they can be in a nation such as Canada. And that's my goal. And yes, it requires tough discussion. It requires tough decisions on issues that we just need to sort out, because this has been going on a long time and we haven't had, you can look at different governments coming and going, but have we moved the bar? And I am committed to moving the bar in a positive direction.
Ms. Grant, thank you, Premier. Simon Delatte, l'Acadie Nouvelle.
Yes, one question regarding the third booster shot for COVID-19 vaccine. So those who will refuse this booster shot and that have already received 2 doses in the past, will they still be considered fully vaccinated? While this is an excellent question, I never heard someone who wouldn't want the third shot, but yes, it could happen. I'm not sure if that would make a difference in terms of the proof of vaccination. At this point, I would say no, it's not going to have an impact on the proof of vaccination, but it could change. As we receive more information on this topic, we can share this information, but at this point, the answer is no. Thank you, Mr. Delat.
Yes, my question is for Dr. Russell. And are there any cases at the St. John Regional Hospital? And if so, could they be categorized as an outbreak?
So as of right now, my understanding is that there is no outbreak declared at the St. John Regional Hospital, but they are investigating, obviously. But I can tell you that at the Moncton City Hospital, that there is an outbreak declared on the geriatric unit.
Thank you. Aidan Cox, CBC.
Hi, this question is for Premier Higgs. What help does the province plan to offer companies or individuals whose staffing or livelihood has been harmed by the long wait for test results? And if there isn't at the moment, why not? And is anything planned for the future?
Well, I think just as we did at the height of the pandemic, we looked at each business and our goal has been to keep them in business. And we're doing the same thing now. And I know staffing levels, and even though whether it's as a result of waiting for testing or it's a result of just can't get people back to work, because we are dealing with that with the federal government in terms of how the CERB is going to transition out into subsidies that actually can help people get back into the workforce. Because I think that is the biggest improvement that we can do as a society to help businesses. It's not about the couple days of whether I'm waiting for a test or not. It's about can I get people to actually fulfill the positions? And all over this province, I am seeing that people, are on a program right now that was needed at one time, but now we need to transition out. And that is a major discussion we're having, not only amongst provincial leaders, but certainly with our federal counterparts, because we need to address that for every business.
Thank you. Michael McDonald, Canadian Press. Well, I'd like to thank the members of the media and everyone for joining us this afternoon. This concludes today's update. Merci aux membres de la média puis tout le monde pour nous.
I would like to thank the media for joining us this afternoon. This concludes today's update. Thank you.